Hi guys, I just wanted to do a couple of frequently asked questions. So some of the most frequent questions that we get at Optimal You are, number one, do we accept insurance? We do not accept any insurance. We are an out-of-network provider with all major insurance companies for a multitude of reasons, but primarily I don't want any insurance companies telling me what I can test and what treatment I can and cannot provide for my patients. This goes for lab tests as well. We are a member of a cash co-op that gives us very competitive pricing for all of our blood labs as well as advanced testings that would never accept insurance, for example, Dutch test or GI maps. We pull everything in-house, and often the cash pricing that we receive would be less or equivalent to the copay you would pay through your insurance company if we were to order through Quest or LabCorp. This again allows me to have free range for the amount of testing, the frequency of testing, and the type of testing that I want to order on my patients, and no surprise bills to you. That's a big problem at other practices. Even if they tell you things would be covered, a couple months down the road, the insurance company could change their mind and you're responsible. We don't want any surprises financially when it comes to our patients' care. As far as care itself goes, we don't accept insurance because we have a lot of hands-on, extensive hours and no appointment time limits. What that means is you get a lot of undivided attention, unlimited care, and we're not billing per visit because we're providing you the amount of care that you need or your child needs specific to you. Because of that, we create customized care plans that are based on your exact length of time and amount and type of treatment that is appropriate for you during that period of your health journey. And again, if we were to charge insurance through that, we'd have to do everything by the books. We'd be really capped and monitored on exactly what we were treating for you for, the amount of times that we were able to see you, and the length of time we were able to see you, and that's not how we like to roll at Optimal You. We do accept health savings account, flexible sending account payments for everything in office, including laboratory testing and supplements. You can also pay with Care Credit, which would allow you to finance for up to 18 months at 0%, and we can help you apply for that. We do have in-house financing for a smaller amount of time at 0% as well. That's not credit-based. So we really try to come up with financial options that will work for everybody, because we never want that to be a barrier to receiving care. So yeah, frequently asked question that we get is, why do we always want to use fresh blood samples and we can't work off of previous blood or previous tests that you bring us from another provider? So first of all, I have some people come in and bring me a huge binder of medical history spanning years and years and years of different testing, imaging, doctor's notes, and I will read through all of it. The more information you can provide to us, the better. But we still want to draw a fresh panel. Unfortunately, most of the time in the allopathic world, the doctors that you're seeing are not going to touch the correct amount of testing that we want to order on you, even on our initial introductory panels. Again, that's because they're monitored by insurances and we are not. So we have full range to really get comprehensive testing done that you likely haven't had done before. We also like to see blood within a 90-day window. So if you have had blood panels done even 3 or 4 months ago, you have a new acute problem or a chronic ongoing problem, to really create proper recommendations off of that, if it's diet, supplements, treatments, we really need to see what's going on currently in your body to have the best chance of getting you better to where you want to be. For that reason, we always recommend drawing blood during your first visit, but we will of course take into account any previous testing that you've had done. Then at your review of findings visit is when we'll make recommendations for advanced testing. Advanced testing means anything beyond that basic introductory blood panel. That introductory blood panel gives us really good direction into deciding if we're going to ask you to spend time, if we're going to ask you to spend money and invest in a stool test, a genetic test, Dutch hormone testing, anything beyond the norm that we're very confident that the results of that test is going to alter our course of care. What that means is that we need that information to properly guide you to get you better. So it's an investment worth your time and our time as a practice to order that testing. That's also why we don't offer advanced testing during the first visit. It takes a lot of hours, a lot of resources on our part as a practice, and investment from you as the patient to order advanced testing from these specialty labs. For that reason, I want to be very confident in my recommendation to you before I ask you to do that and make those choices, and we can make them together after seeing that initial blood panel, doing a history, doing an exam, getting to know you better. So if I ask you to spend your money, spend your time, trust in me as your provider, I'm very confident that I need that information and it will be worth our while to continue to get you where you want to be. Frequently asked question number 3, who can we see in our office? What age ranges do we treat? At Optimal You, we will see everybody from pregnant women, newborns, all the way through to the geriatric population. We love to treat families all together. We highly recommend that. If you're coming in, you're just wanting to optimize health, get custom diet recommendations, really see where your family stands as a whole, call and ask us about our Family Day specials. It's usually easier, especially when I work with a lot of moms, if we can get everybody in and start to make lifestyle, diet changes, low tox options in the household, different things going as a team. When you have your spouse, your partner, your boyfriend, your children, if you're a mother with older kids, all on board doing this together, it is far more effective and easier to implement and maintain and make everything that we recommend and teach you about permanent staples in your life, and that's our goal.